In this video, we're going to show you how to assist with intubating a patient using a Glidescope. Okay, so first we're going to set up our ET tube for the patient. So we're going to get the size V1s. Then we're going to grab a Glidescope stylet. It's very durable. You cannot manipulate it at all. So we're going to lube it up so that it'll be easier to come out of the patient when you're ready to take it out. So you can go ahead and just spread some lube there. Okay, then you can go ahead and place it in our ET tube, just like so. We also want to make sure our ET tube balloon is deflated all the way. So go ahead and connect our syringe, deflate it. Once your ET tube's ready, you're gonna wanna get your blade ready. So we have our size 3 and 4 for blade for our Glidescope. So it has make sure it has our hyper angle port right there. So when we use it, we can connect our cord and it'll just give us our view right here. And you're ready to intubate after that. Now the provider is masking the patient, pre-oxygenating the patient so that when we're ready, we can intubate. So what you can do when you're assisting is make sure you have the ET tube ready in your hand and then make sure the Glidescope blade is ready with a visual on the display showing. So the camera's working, it's going good, it's plugged in. Make sure it's plugged in always so that it doesn't turn off spontaneously during the intubation process. So always make sure it's plugged in. And facing the provider, a good angle. Make it as easy for the provider as possible. Okay, so once the provider is comfortable with the pre-oxygenation levels, then they're gonna be ready to intubate. So the provider has their view of the airway with the blade. They can see the visual on the machine. So you're gonna want to hand the ET tube to them, the J facing towards the patient's foot, the angle of the airway. You don't wanna have it facing the other way because then they'll have to turn it. You wanna make it as seamless as possible to when you hand it that they don't have to make any other adjustments to it. They can just grab it and place it. But in addition, you also wanna ask them if they want to have you hold some cricoid pressure. Holding the cricoid pressure is important for when the patient's high-risk aspiration, make sure they don't vomit into their airway, or for positioning to get a better angle of the airway, you can use cricoid pressure for that as well. So the provider has a good angle of the good view of the airway, so then they're gonna ask for the ET tube. All right, you're gonna place it in their hand. They're gonna pass the ET tube down in the vocal cords. And at that point, when they're past the vocal cords, you're gonna ask for the stylet out, like she just said. You're gonna wanna pull towards the patient's foot. You don't wanna pull straight up because then the ET tube gets dislodged out of the airway. So pull towards the patient's foot like that, out like that. Then you're gonna go ahead and inflate the cuff, like so. Then you're gonna grab the circuit, the elbow connected to the end of the ET tube, and you can go ahead and take a hold of that ET tube so the provider can go get their tape and secure it properly. So this is going to be our vocal cords right here, and they're going to see the tube pass through the vocal cords, and until the end right there passes the vocal cords, that's when they ask for a stylet out. All right, there.